Everyone. Okay, great. There we go. So I want to talk today about the budget cycle. As we mentioned, about the possibility or the projected deficit we've heard about, what we know with what new estimates we have, and talk about some of the options facing that. I'm going to try to walk you through some of the calculations of how I go through these numbers. So it might be a little bit wonky, but I hope it makes things clear. I'll talk a little bit about the revenue and caseload estimating conferences, how those work, how the budget process works. So that's really evident to folks. So this chart just reviews the state budget cycle. We're always in the middle of closing one cycle and starting another one. So right now we're in the middle of fiscal year 2025, which runs from July of this year to June of next year. A lot of what we're talking about now is the proposed budget for fiscal year 26, which will begin on July 1st next year and end on June 30th of 2026. We're at that stage of this annual process where in the summer and fall, the state agencies have submitted their budget requests to the governor and the Office of Management and Budget for consideration. We've just had the caseload and revenue estimating conferences, and now the governor and OMB are designing their budgets to propose in January. That's where we are in this process. I'll say a little more at the end about what comes next. So the general context here is that, as folks I think know, the generous federal pandemic assistance that we've had the last few years is winding down. That's all been allocated. Most of it will be spent by the end of next year, maybe a little bit after that, but that is basically gone. We have the possibility of decreased federal assistance going forward. I have no way of quantifying that. There have been talk about plans to potentially make cuts in Medicaid and SNAP and other programs. Enhanced assistance for healthcare marketplace premiums will expire if not renewed next year. We have no way to quantify that or what effect that might have on the state budget or on Rhode Islanders. The other piece of the context is that a few weeks ago, the Office of Management and Budget released a report where they estimated a possible structural budget deficit for 2026 of $398.2 million. This is before we had the recent revenue and caseload estimating conferences. And the report itself did include qualifiers that this was not an absolute number or prediction, that many factors could change that. So just general review of budget. So we have the annual state budget. There are 4 funding sources for that budget. There's general revenue, which are state funds. That's most of what we're talking about today. What are the money raised by the state and spent by the state? There's also federal funds, another huge part. A lot of that is matching federal Medicaid funds. Then there are some restricted receipts and other funds include things like have to do with transportation, other monies that are raised particularly for something and only spent on that thing, on the unemployment insurance fund, for example. The numbers here are the current enacted numbers for the fiscal year budget. So out of the total of almost $14 billion, we're focused today on this sort of $5.6 billion or so in state general revenue. Because that's what we have control over. That's what legislators and the governor have control over in terms of what they can spend. And when we talk about a deficit, that's the money we're talking about, a deficit and how much money we need to spend as a state and how much we're raising as a state to do that. And when we talk about all funds, it's talking about all 4 of these pieces put together. Okay, so when we talk about state general revenue, what are we talking about? There's basically 2 kinds of things we're talking about. You can see here on the left side, we have taxes. The biggest category is personal income tax, almost $2 billion a year now. We're getting close to that. The next biggest part of that are sales and use taxes. And then we have other taxes like the general business corporate tax, much lower than the other 2 categories. And then other taxes, which include things like the estate tax and property, transfer taxes. And then on the right side, we have other important pieces of revenue, include departmental receipts. This is money, fees, fines, like money that goes to DMV that are particular fees that aren't really taxes. Those go into departmental receipts. We'll talk about the hospital fee later. And then something like the lottery, hundreds of millions of dollars each year in revenue from the lottery. And when you put those two pieces together, the taxes and these other kinds of revenue, that's where we get state general revenue. And to give you a look at what happens at the revenue estimating conference that happens twice a year, is they go through each of these categories. You see them all on the left here. And then they get together, and the conferences have three parties, three conferees. When it says budget here, that doesn't mean that means the Office of Management and Budget. That's what it refers to here. So OMB is there, the Senate Fiscal Office is there, and the House Fiscal Office are there. And they're the three parties, the three conferees, we call them, I guess. And they each come into the conference with their estimates. They've heard testimony. They have their models in their files of how they're judging things. And then when I say testimony, like expert testimony from economic forecasters generally and from departments. And they each put that into their models. They come up with a number, and then they get there and they have different numbers on the last day of the conference, and they have to talk that out and figure out what they should agree on, how they might adjust what they're thinking, how are other people looking at this, and they come to an agreement. That's what the consensus is in the right column. And so this consensus shows that at the end of the conference a couple weeks ago, they said we have total general revenues we're expecting from all these individual lines of $5,467.1 million in revenue that we're estimating will happen in 2026. So it's a little bit of the process there. Then there's the caseload estimating conference that happens with the same three parties and sort of around the same time. There are three parts to that. There's cash assistance, and you have a caseload. It's called caseload because you forget how many people is the state serving from various programs, and then how much does it cost? These are things that once someone is guaranteed these services, the state has to provide them. So there's cash assistance, which includes things like Rhode Island Works, which is direct cash assistance, childcare subsidies, SSI. Second part is funding for developmental disabilities, such as residential and community services, and how many people are served by those programs and the costs for that. And then last, and the largest category is medical assistance, which is basically Medicaid, includes hospitals, long-term care, managed care, pharmacy. Again, how many people are being served by these programs and what are the costs? Just a few examples quickly to go through. I'm highlighting here Rhode Island Works, which all the money, we used to spend state money on this. We haven't done that for about 15 years. So all the dollars you're looking at here are federal funds, but it makes a good example anyway. So in the budget that was enacted 5 months ago or so, they said we're expecting to serve 9,272 people through this program. That's on sort of this marked off area on the left here. And that will cost about $32.7 million from that federal TANF block grant. And then the next column is what DHS said. This is how many people we're serving this year, we think. And then the three different partners to the conference say, well, based on that information, our modeling, this is what we think. And they come to an agreement that's on the right side there. So an increase in how many people they're expecting to serve and what the cost will be, that in this case, about over $35 million. More important for us now in understanding the possible deficit is the total cost from all three of those areas: the cash assistance, the developmental disabilities, and the medical assistance. And the piece on the bottom here shows the total spending for all three. And we're not even interested right now for the total costs, which are in the bolded numbers, but we're interested in the general revenue, how much state funds are involved there. And you can see that when the budget was enacted in June, they allocated $1,574.7 million for that, and that amount is a bit lower by about $23 million based on what we know now total. So that's extra money we had allocated that now can be reallocated because the caseload estimates are down a little bit. And this shows similar numbers for what the conference adopted for fiscal year 26. Again, for Rhode Island Works, seeing the number of people going up to about 9,700. And then the costs on the right side, how much general revenue they're projecting to will be needed to cover those costs. And that number is important, these numbers on the right, because that's what the governor and OMB have to work with in proposing their budget for 26. Okay, so now how do we calculate a projected deficit? And basically the deficit, and the issue is that there are many ways to do this. But basically we need to know how much we're going to spend, or we're likely estimated we're going to spend.
Oh, the fire is ready. Please come make a fresh drink. Hi, how are you? Good, how are you? Good. May I do the
Please,
numbers?
mute.
Damn, I never know what I want. All right, let's do
Okay, so to get the projected deficit, we need three pieces of information. How much do we estimate we're going to spend? And that's a bit of an unknown, but we can estimate that. How much do we have on the bottom here? What's the general revenue? That's a number we talked about above. How much did the conference estimate we have to spend? And then in the middle, the leftovers from the current fiscal year. It's a technical budget term, leftovers. And so we'll go over what's there. So if we add together what we expect to raise in 26 and what we have left over from the current fiscal year, that's how much we have available to spend. And then we have to compare that with what we think we need to spend. You always hope the amount we have is more than the amount we need to spend, but we have a deficit when that's not the case. So I'm going to run you through a few different possibilities for how that's going to work. And we'll take those three numbers backwards. So first, how much do we have to spend? So we have that $5,467.1 million that the conferees agreed on is how much revenue we're going to raise, or we're likely to raise. It certainly will change somewhat. We hope it'll go higher, but that's the estimate based on the best information they had. Now, in addition to that, we have to add on what's called the hospital licensing fee. And it's a weird kind of thing. We have this annual licensing fee on hospital services that they pay to the state government. But instead of something like, the sales tax that is 7% and 7% every year, this has to be, by state law, it has to be reenacted basically every year. So this will be in the budget, the governor's proposed budget. It's no one thinks it's, I think, going away. Nevertheless, it doesn't technically exist as a part of law every year going forward. So it's not part of the estimates that the conference puts together. So we take the number that for the current year, which is $215.7 million, and we add that in because we're fully expecting that licensing fee to be reenacted by the General Assembly and be part of the budget. So we put those together. We have total estimated general revenue of $5,682.8 million. Now we want to put into that what I was calling the leftover, sort of jokingly. But compared to what we knew when we enacted the budget 5 months ago, we knew there was going to already be a surplus from the previous fiscal year from 24 that ended in June. But those numbers are coming in a little higher than we realized because of some changes. So that's another extra $12.8 million. The conference said there's a surplus of $67.5 million in revenue, more than we thought we had estimated 5 months ago, from various of those different line items. We saw earlier, I showed you how the caseload number was down slightly by about 23 million. So that's sort of extra money that could be, in principle, either reallocated in this fiscal year or saved for 26. Taking away from that, we have some additional expenditures. So people may recall that there's an increase in the pension and cost of living for state employees that was not part of the budget that was enacted. So some other changes, including some adjustments to the rainy day fund, about a little over 25 million, 26 million total for that. When we add all those pieces together, these are different information than we had than we enacted the budget in June of this year. There's about $77 million more available to spend. So we take that together. We add the 77 million. We add that to what I showed you before, which was the revenue that was estimated plus the hospital licensing fee. And altogether, that's $5,759.9 million in total state revenue for 2026. It would be nice if we could spend all of that, but by state constitution, also nice, we put aside 3% into the rainy day fund every year. So we have to take off the top of that 3% that gets put aside into the rainy day fund. Though the truth is that the rainy day fund is capped at 5% of general revenue. It's already basically full right now. So the overflow money, which is much of that, will go into capital plan funds eventually. But what it really means is that the General Assembly, the governor, like the governor of the proposed budget, has $5,587.1 million in state funds to spend on the budget. So that's the basic thing that we're working with in terms of what's available for fiscal year 2026 after we put all of those pieces together. So now we have to figure out the piece of how much we're spending. And there's different ways to do this. And so there's not going to be one right answer. One way is to estimate by just some percentage, like spending increases by a certain amount each year. And let's take our estimate from that. That's what the OMB number from a few weeks ago that came up with that $398.2 million. That's what they did. They said spending is likely to increase by this much, revenue is likely to increase by a certain amount. So not based on sort of actual numbers, but by projections, percentage projection, I should say. That's one way to do it. Another way is to look at, what are the agencies requesting? What do they need for their budgets? And as we noted earlier, when the OMB gave instructions this summer to agencies and departments, they said, give us two budgets. Give us how much you need to provide the same level of services you're now providing for the current fiscal year. And then give us something, what they call a constrained budget, where you cut that by 7.5%. So if we have to make cuts, we have that built in. And so one could estimate our spending based on those numbers as well. And so that's what I'm doing. I'll show you the different options here. I know it'd be nice if I give you one answer and one number. I'm not going to do that. So let's start with the different possibilities of expenditures. The top one is how much OMB projected in that report a few weeks ago. They said based on this, just applying a percentage, we get to the $5,873.5 million. If we then go look at what the agencies have said they need or they would have spent if they cut, so we actually have two different sets of numbers. OMB sent agencies target numbers, said, we'd like you to meet this target. And then we have what the agencies actually submitted. So in the middle rows here, or sort of the middle here, I have what those targets were that OMB put out there for what a current services budget should be, and then what a 7.5% less constrained budget would be. And then we have the actual requests that the agencies and departments submitted to OMB. Now, I've seen many of them, including the largest of them, but I haven't seen all of them. And so that's why on the bottom I have ranges. And so the agencies have not, I guess, met the target when you take them together that OMB provided. So in order to maintain a current services level, but a services budget, the agencies look like they're requesting about $5.8 billion. And under a constrained model where they have to make cuts, the totals are around $5.6 billion. So I want to give you some deficit estimates based on these different possibilities. Taking the first one, this is how OMB calculated it a few weeks ago. We take on the top here what we now know about revenue. We take the middle, what they projected for expenditures. And instead of a $398.2 million deficit, we would be looking at a $286.4 million deficit. So even under, I guess, worst case scenario here, it's much better than it looked a few weeks ago. Now, if we step away from that and look at what are the agencies saying and the departments, so I'll start with a constrained budget approach. So if the agencies had actually, met the constrained budget request of OMB, then we would actually have enough revenue that we wouldn't have to cut everything proposed. Those constrained requests came in a little higher, as I noted, in that $5.6 billion range. And so if the governor were to make, include in the budget all the cuts requested under that constrained approach, there would still be a very small but slight deficit, even under that constrained approach. And, I think the most, a reasonable, hopeful model is that we at least provide a current services level budget next year. And from that perspective, it's still not ideal, but better than what the OMB numbers would suggest. And that's sort of this middle, I guess, from their target, it would be $158.5 million deficit. And then if we actually look at what the agencies and departments have requested to maintain current services, the bottom row here, that approximately $5.8 billion, my calculations are a deficit that's a little over $200 million based on that top number, the 5587.1 available to spend, and that 5.8 billion that the agencies or departments are telling us they need to provide a current services budget. So certainly better news than the almost $400 million deficit that was being shared a few weeks ago. Obviously not ideal. And we should note that there's still a real possibility, as happens in many years, that we're going to end with a larger budget surplus than we expected, that the numbers we have, we're going to have better revenue collections than we thought, possibly lower spending for other things. But without making any changes to the budget, given what we know about revenue, it appears we don't have enough revenue to avoid some cuts, though there is an alternative, which is to raise new revenue to at least partially, if not wholly, offset that. So I just want to suggest or argue that now's not the time for an austerity mindset, that we shouldn't be making severe budget cuts. We shouldn't take an attitude of let's just cut everything across the board, because that might save some money in the short run, but it could also harm the economy, harm people in the short term, harm the economy in the longer term. Austerity spending creates a cycle that dampens economic activity. And we know, we just witnessed through the pandemic that with the generous federal assistance, including things like the enhanced federal child tax credit, that helped stave off a recession that didn't happen. And it was in part because of those investments. The state is constantly required to have a balanced budget, making this challenging. We need to think about this and not just go into austerity mode and make lots of harmful cuts. And now I just want to go through some of the cuts that have been proposed by agencies, and maybe in the Q&A and discussion, folks on the call can step in and mention some other possibilities. I mean, there are lots of things. I'm only going to mention a few, but I'll mention a few types of things or a few other pieces of the context here. One is that although OMB requested this number of 7.5% cuts for the constrained budget, there's some state spending that is exempt from that, meaning you have to make higher percentage cuts from other programs. So for example, the Office of Healthy Aging, 65% of their expenditures have to be made. You can't make a 7.5% cut in those. So it means they need it for their maintenance of effort to secure federal funding. And so if you can't make 7.5% cuts there, you have to make larger cuts in the 35% that's left to get to this target of 7.5% overall. So, for example, one proposal from the Office of Healthy Aging would cut about $750,000, or 20% of the budget of state spending on non-emergency medical transportation that helps older Rhode Islanders get to medical appointments, important medical appointments. And I should note that when agencies are making these proposals, it's not like that they're nefarious and want to make cuts. A lot of these, and as you'll see, I'll show one example. They don't want to make cuts. They're trying to figure out what they can propose. In some cases, I think agencies we know are making cuts, are making proposals they know will never be accepted. So as a way to avoid that. But anyway, that's one thing here one piece of this context I wanted to share. Medicaid cuts, I mean, Medicaid's a huge part of the budget, but they can be particularly problematic to make cuts because they almost always involve federal spending. And depending on the program, we call the FMAP rate, for each program, each $1 we cut in state spending could lose us another $1 to $9 in federal spending on care. So it doesn't mean we never want to do that, but we need to think about, we're not just cutting $1 worth of care when we make that cut in state funding, but we're cutting care by a larger amount. So we need to be really thoughtful about that. So one proposal that came out of EOHHS in this regard, this is not a 9-to-1 example, but they propose eliminating one category for Medicaid and medically needy and lowering thresholds for two others. You see here that would save about $25 million in GR, that's general revenue, state revenue, in 26, but also another 31, it would lose us another 31.4 million in federal funds and even more in the following year. Now, I said the good news is that some individuals get cut from programs like this might still qualify for different programs, though the other part is that if they then qualify for other programs, that would reduce the savings you're attempting to make from this. So I'm sure what to say about that. I just, I pasted into here in these agency and department proposals, they have to explain a lot of detail. There's a formal process for doing this. And under this particular proposal, EOHS included implementing this proposal would undermine the agency's mission. So they're being told you have to propose cuts to us, and they're telling us that this would undermine the mission to do it. So just fascinating to look at some of these documents. And then I just want to say that there's some cuts that are very small in the context of talking about a deficit of hundreds or tens of millions of dollars. It could still have profound impact. So a proposal to cut Meals on Wheels by $75,000, that will cut 13,000 meals. Or security for housing for the elderly, cut 85,000 to this program, which would have profound impacts for people who benefit from these programs, and sort of hard to see like how many of those little things you have to put together to make any impact on what we're talking about in terms of a deficit of possibly $200 million. Okay, so one option then is not to make so many cuts or any cuts and to instead raise new revenue. One proposal that EPI and others have supported is to have a 3% surtax on income above $1 million. The fiscal and tax years are different years. Fiscal year we know starts in the middle of the year, but even with a tax year 2026 start date for such a proposal, some of that money would still come in for fiscal year 26. A fiscal note from this past year had estimated almost $88 million in the first year, and much more going forward. So, those numbers may change, but we still could have a huge impact by including this in the enacted budget. And if the governor to include this in the proposed budget, then the governor would have that money or some estimate of that money available to spend. That would help at least narrow that projected deficit. Other possible revenue-raising measures would be something called worldwide combined reporting. You will likely hear more about. That will prevent corporations from hiding profits overseas. This has to do with taxing corporations on the business they do in Rhode Island, what they sell to Rhode Islanders. But currently, if they shift some of those profits overseas, we can't tax that, even though they've been done on sales in Rhode Island. That could raise tens of millions of dollars. a mansion tax on owner unoccupied second homes also been proposed. There may be other proposals that could increase revenue and increase tax fairness while to help cut down on a deficit, a possible deficit. And I'll just note that with federal tax cuts for the highest income filers likely to be renewed next year, that even if we enacted something like this on the state level, those folks probably be doing better on balance from the savings on their federal taxes, even if we modestly increased on the state side. And this would increase tax fairness. We've shown versions of this before, but even though we have a generally progressive personal income tax structure, we take state and local taxes and all state and local taxes, including sales and property taxes. The top 1% pay a lower percentage of their total income than the other 99%, and particularly the lowest 20% of income pay the highest percentage. And doing something like a surtax on income over $1 million would bring the top 1% group at least into line with the next 79%. So it would not only increase revenue, but improve tax fairness. So what's next? As I close out here. In January, the government proposed a budget for fiscal 26 and a revised budget for the current year. As I noted, what the governor is allowed to contain in that budget is generally framed by the numbers coming out of the Revenue and Caseload Estimating Conference. But if the budget were to include revenue-raising measures, that amount would be increased. So in principle, we have the next 1 or 2 months to help shape what's in that proposed budget, to make the case for increasing revenue instead of making harmful cuts. After the budget is released in January, there will be hearings to House and Senate Finance. We'll have monthly reports on revenue collections, a second quarter report in February on the current fiscal year's budget, give us some sense of whether we can expect a bigger surplus, our revenues coming in more strongly than anticipated right now. And there'll be opportunities to, say, testify before committees on various measures. Though I think we hope we don't get into a fight of, don't cut my thing, cut someone else's thing. Then in April and May, we have the Revenue and Caseload Estimating Conferences that will take all of the new information from the intervening months and give the budget, those who are finalizing the budget, final numbers they have to work with. Again, revenue-raising measures could be included in the final budget to change those parameters, and there'll be opportunities behind the scenes and at hearings to weigh in on all that. That's all I have. If you have any questions, sort of maybe technical questions, I'd be happy to try to answer those, and otherwise we could have some time for discussion as well, and please keep in touch with EPI.
Thank you, Alan.